Okay, hello guys. Good evening. I hope you have finished the quiz discussion which was happened in the DocTutorials app. This is about the discussion of those questions. Most of the students were actually messaging me regarding the questions were moderate to difficult subtype, and we'll be discussing those questions one by one. And this is the first question. I hope you can see the screen right now. Good. The first question. A patient sustains a head injury in a road traffic accident and shows signs of elevated intracranial pressure. What are the signs of elevated intracranial pressure? Patients might land up in vomiting, or there might be any head injury signs. One of these important signs is going to be vomiting and also giddiness, and some might be from bleeding from the ears. Anything it is going to be. Which diuretic is most suitable for reducing intracranial pressure in this scenario? Some of you have answered this question very much right. The answer for this question is going to be option A, mannitol. And why is that? It's because mannitol is actually an osmotic diuretic. Mannitol is an osmotic diuretic. Here the issue is patient is suffering from cerebral edema. We have to decrease the fluid. We have to take out the fluid from those areas and throw it out of the body. For that, we prefer to give a diuretic agent, which is going to be increasing the urinary output. Thereby, the fluid output is also going to be increased out. Out of all these agents, we have osmotic diuretics. Option B is spironolactone, which is a potassium-sparing diuretic. Option C is astazolamide, which is a carbonic anhydrase inhibitor, and hydrochlorothiazide, which of course the name itself implies it is a thiazide diuretic. Okay. These are the four major diuretics which is given in the options right now. We also have one more which is loop diuretic like furosemide. Now, out of all these agents, why do we choose to give only this mannitol for the treatment of a patient with intracranial hypertension or raised ICP? Because this drugs, for what are the different conditions for which we use an osmotic diuretic? Remember with this mnemonic OCD. OCD is the mnemonic, the uses of an osmotic diuretic. This is the one-liner from which the question has been designed on. OCD is the mnemonic. O is for oliguria, which is decreased urinary output. We can give an osmotic diuretic which might increase the urinary output. C is for closed angle glaucoma. CAG stands for closed angle glaucoma. And one more C is for cerebral edema. One more C is for cerebral edema. And as we can see here, this patient is a case of cerebral edema. So for that, we administer an osmotic diuretic. And the last one is D. D stands for drug overdose. Drug overdose, for example, if a patient is suffering from lithium overdose, or even a salicylate overdose, or bromide overdose, in all of these cases, to increase the drug output from the body, we prefer to give an osmotic diuretic. And one more D is there, which is named as dialysis disequilibrium syndrome. Dialysis disequilibrium syndrome. So this is the mnemonic, my dears. OCD. OCD is the mnemonic. These are the different uses of osmotic diuretic. Very important question. Multiple times it has been asked in majority of the exams. But sir, what about these questions? What about this spironolactone? Spironolactone is a potassium-sparing diuretic, which is a steroidal derivative. Thereby, it might be producing sexual adverse effects, like patients might develop gynecomastia and erectile dysfunction. These are the adverse effects of spironolactone. Astazolamide, on the other hand, is a carbonic anhydrase inhibitor. The most common adverse effect of astazolamide is paresthesia. The most common adverse effect is paresthesia. Hydrochlorothiazides, it might be producing hypokalemia and multiple other like electrolyte abnormalities. Primarily here we are talking about hypokalemia. These are the classical features of this question. So this question is regarding the uses of osmotic diuretic. Remember with this mnemonic, OCD is the mnemonic. Oliguria, closed angle glaucoma, cerebral edema, drug overdose, and dialysis disequilibrium syndrome. The next question, which of the following drugs will cause tossa de pointi if we given with erythromycin? First of all, we have to know what is tossa de pointi and what is an erythromycin. Tossa de pointi is nothing but a type of an arrhythmia where the ECG will appear somewhat like this. Okay, this is called as alternate peaks or dancing around the point. That is named as toss at the point. Any drug, if it is producing QT prolongation in the ECG, which means a drug which has got a potassium channel blocker property. Any drug, if it has got a potassium channel blocker property in the heart, will tend to produce QT prolongation. QT prolongation is an ECG finding. Okay. So whenever you administer 2 or 3 drugs together, which tend to be producing more like QT prolongation, patients might progress on to torsade the pointy or dancing around the point. Okay. Now, what about this erythromycin? Erythromycin is a macrolide agent. Erythromycin is a macrolide antibiotic. For those students who have not completed antibiotic set, please understand that we have two important set of antibiotics, aminoglycosides and macrolides. Both of these drug name will be ending with mycin, MYCIN. Both of these drugs will be ending with MYCIN. But if the drug name contains romycin, it is a macrolide antibiotic. If romycin is not there, that is an aminoglycoside agent. Okay, a simple thing to remember, aminoglycosides and macrolides both will be ending with mycin. If it is romycin, it is a macrolide antibiotic. Okay. Now, what about the options here? Let's look into the options. Option 1 is astemizole. Astemizole is an antihistaminic drug. Levofloxacin is an antibiotic agent. Levofloxacin is an antibiotic. Fluoroquinolone, we used to call them as fluoroquinolone antibiotics, like levofloxacin, moxifloxacin, ciprofloxacin, all the floxacin agents. Amoxicillin is a penicillin antibiotic agent. Ceftriaxone, as most of you would be knowing it, this is a cephalosporin antibiotic. This is penicillin antibiotic. This is a cephalosporin antibiotic. All of these three, option B, C, and D, are all what your antibiotic agents. Option A is an antihistaminic drug. Okay. Now here, what is the take-home point? Erythromycin is a macrolide antibiotic. We have two important things to be remembered. The first one is macrolide antibiotics are powerful microsomal enzyme inhibitor agents. Macrolide antibiotics are powerful powerful microsomal enzyme inhibitor property. Especially we are talking about erythromycin. Especially we are talking about erythromycin. Now here the question is, we have three important drugs, buddy. We have three important drugs. The one is named as terfenadine, astemizole, astemizole, and cisapride. Three drugs are there. We have something common between all of these three drugs. All of these three drugs are banned because these drugs, when given with a microsomal enzyme inhibitor like erythromycin, this might produce torsade point. It might produce prolonged or extensive QT prolongation. Patient might progress on to QT prolongation, which might lead on to torsade point. Now, this is the reason why these three drugs are currently banned. It is not used in clinical practice. Out of all this terfenadine and astemizole, these drugs are antihistaminic drugs. Whereas cisapride is a 5-HT. What is 5-HT? 5-HT stands for serotonin, 5-hydroxytryptamine. 5-HT4 receptor agonistic agent is cisapride. So terfenadine and astemizole, these are antihistaminic drugs. Cisapride is a 5-HT4 agonistic agent. All of these three drugs are banned because when given with cytochrome P inhibitor might produce torsade point. Now we know here we have this erythromycin which is there in the options. Yes, we have erythromycin which is there in the option. Torsade point is there in the option, and we have astemizole also there. All of these three are interlinked. So the answer for this question would be astemizole. Is that clear? And of course, we can add one more point from this, and that is we have this terfenadine, right? Terfenadine might be producing this torsade pointy. That's the reason why we have derived one more drug from terfenadine, which is named as fexofenadine. Fexofenadine is a derivative agent from terfenadine. It has got a classical feature, and that is it will never produce torsade point. As per safety, fexofenadine is a better drug. That's the reason why it can be given with cytochrome P inhibitors. It can be administered with cytochrome P inhibitor. It can be given with erythromycin. This interaction or the ability to produce prostaglandin will not be seen with fexofenadine. We have a famous brand named as Allegra. Fexofenadine has got no potential to produce that. Terfenadine will produce, derivative agent fexofenadine will not produce. Okay, so the answer for this question is easier, astemizole. Moving on to the next important question here, guys. This question is about which of the following beta blockers is effective in patients with reduced ejection fraction and has been shown to reduce mortality in chronic heart failure without causing long-term worsening of the condition? Okay, so first of all, we have to note what are all the drugs which can be used to decrease the mortality in a patient with heart failure. Here they have given reduced ejection fraction, which means they're talking about heart failure with reduced ejection fraction. HFrEF is what they're talking about. Heart failure with reduced ejection fraction. Which drug can produce a decreased mortality? We have a bigger list of drugs. All can be remembered with the mnemonic BSAMs. BSAM is the mnemonic. Usually, we use the terminology BSAM for among antibiotics named as broad spectrum antimicrobial agents. We are going to be utilizing the same terminology here for remembering the drugs which might decrease mortality in a patient with heart failure. What is the decreased mortality? See, when a patient is suffering from acute heart failure, patient might present with dyspnea because of pulmonary edema. In those conditions, you have to administer furosemide. If dobutamine is there, we can opt for dobutamine. We can opt for like nesritide. Multiple drugs are there. But the drugs which can be while you are planning to discharge the patient, which drug has to be given for the patient so that the patients will be having a prolonged survival period. Those drugs are named as drugs which might decrease the mortality in a patient with chronic heart failure. Remembered with the mnemonic BSAM. B stands for beta blockers. B stands for beta blockers. S stands for SGLT2 inhibitors, sodium glucose transporter type 2 inhibitor, which is an anti-diabetic drug which has got usages for heart failure too. We have sacubitril. Sacubitril. A stands for ACE inhibitor, ARB and ARNI drugs. ACE inhibitor, ARB and ARNI drugs. ARNI stands for angiotensin receptor neprilysin inhibitor. M stands for MRA, mineralocorticoid receptor antagonist agents. These are all the drugs which can be used to decrease the mortality in a patient with heart failure. But out of all these drugs, the question here is about beta blocker. Which beta blocker can be used to decrease mortality? See, the concept of using a beta blocker in a patient with heart failure is highly a controversial statement before. But after that, we found some drugs which tend to have a very good response in terms of mortality. So how can we put forth this? Beta blockers usually will be decreasing the cardiac contractility. It will be decreasing the heart rate. That's the concept of a beta. I hope you remember that mnemonic. Beta 1 receptor is there in heart. So when beta receptors are stimulated, that will increase the cardiac contraction, increase the heart rate. Whereas beta receptors are blocked, that will decrease the cardiac contraction, that might decrease the heart rate. Here, heart failure is nothing but when the cardiac contraction is getting compromised, the cardiac output also is getting compromised. That's the concept of heart failure. But here, when you give a beta blocker, it will also further decrease the cardiac contraction, right? That was the major controversy before. But later on, not all the drugs, some beta blockers can be safely administered in a patient with heart failure because those drugs will primarily decrease the heart rate than increase in the cardiac contraction. For example, what are all the drugs? Remember with this mnemonic, non-MBC is the mnemonic. Non-MBC is the mnemonic, the beta blockers which can be used to decrease the mortality in a patient with chronic heart failure, CHF. Non-MBC, N is for nebivolol. N is for nebivolol. Metoprolol. I hope you remember that beta blockers are all ending with LOL drugs. B stands for bisoprolol. Bisoprolol. C stands for celiprolol and carvedilol. These are all the drugs which can be used to decrease mortality in a patient with heart failure. Good. Out of all this, the least response, recently it has been found out that the least response can be seen with nebivolol, even though it has got no major heart failure survival benefits, but it can be used in terms of chronic heart failure. So out of all these drugs, which drug is going to be there in the options right now? As we can see, this patient, they're asking about beta blockers, the clincher terminology, number one. Number two, reduced ejection fraction. Patient, they are referring a patient with heart failure and chronic heart failure. These are the three major concepts. Three major one-liners from which we can easily land up in the option, and that option is option B, bisoprolol, because propranolol has got no role. Pindolol is not there in the mnemonic. Esmolol is also not there in the mnemonic. Primarily, esmolol can never be used in terms of chronic heart failure because esmolol is a short-acting drug. Esmolol is a short-acting drug used only for acute conditions or acute emergencies like hypertensive emergencies. It is not been preferred in terms of chronic heart failure. Propranolol has got multiple different uses. What all the different uses of propranolol? This is an important question, guys. Propranolol can be used for multiple different conditions. All of this can be remembered with the mnemonic OP has ATM. OP has ATM is the mnemonic. Okay. O stands for obstructive cardiomyopathy. O stands for obstructive cardiomyopathy. P stands for panic attacks. Hyperthyroidism, because propranolol has got additional response of inhibition of peripheral conversion of T4 to T3. AS stands for aortic stenosis. Actually, it's subaortic stenosis. Subaortic stenosis. A stands for anxiety and akathisia. I hope you know what is an anxiety is. Okay, what about akathisia? Akathisia means restlessness. T stands for tremor, which is essential tremor, and M stands for migraine. We are talking about here prophylaxis of migraine. These are all the different uses of propranolol. Of course, there is no heart failure over here, which means propranolol can never be used for heart failure. Propranolol uses is an important question. Propranolol, osmotic diuretics, both of these uses are extremely important, guys. Remember, I hope I'll just repeat it back. OP has ATM is the mnemonic there. Okay. Now, with these options, as we can see, the answer for this question is going to be bisoprolol. We have discussed those important questions, most important controversial areas to be targeted as per your pharmacology quiz is concerned, guys. I hope we have kept it short and sweet. We'll meet up in one more session as early as possible. Good night. Bye-bye.